right now we're going to be joined by a gentleman by the name of Todd Pickard, and we're going to talk about some healthcare and technology and how they kind of blend together and do what they do. Right now, the AAPA 2024 is the world's largest conference for physician associates, or PAs, and a chance to highlight the trends and innovations shaping the future of healthcare. Joining us now to discuss from AAPA 2024 in Houston, Texas, is Todd Pickard, a vice president of AAPA. Todd, welcome to the show. How are you doing this morning?
I'm doing great. Thanks for the invitation. I'm happy to be here.
Anytime. What's the latest news coming out of AAPA 2024 this year?
You know, it's an amazing opportunity. There are thousands of PAs from across the country that are gathering here to network and learn about things like AI and wearable technology. In fact, my cameraman is wearing a device that monitors his steps, his heart rate, and we're learning about how these tools will impact our patients' lives and how it'll help us treat and take care for patients.
Well, what are some of the other ways that technology is impacting the future of healthcare?
Well, it's amazing. We are developing new technologies that help us design specific treatments for patients. AI is actually is in the clinic with listening in and documenting and writing notes. You can even schedule appointments and get reminders with an AI tool. It's really amazing. And the wearables are just innovative. We are able to monitor patients, let them spend more time recovering and recuperating at home and helping them monitor their own health care. And we help them understand the data and what it means to their health. So I think we're just at the tip of the iceberg. I think it's going to just increase, but I'm excited about how technology and AI will partner with us to care for patients.
Now, we're not just talking about wearables like in watches, are we? We're talking about other devices that can literally be worn, may not be seen, but we're talking about other things, correct?
Yeah, absolutely. Things that can monitor blood glucose, blood pressure, all kinds of devices in your home. There's a network of things. If you think about all the things that are connected to Wi-Fi in your home, that is going to continue to increase, and more of those will be health related to monitor you, to actually have people, you can pick up the screen, I guess, and say, hey, I need to talk to somebody, and you'll have people there right away. So it's really, I'm excited about how far this is going to go. I think it's the difference between, phones like we used to have and all the phones that everybody has now. We're not even going to understand what the past was like.
Now, does this make it easier for the patient to get access to their information as well?
Absolutely. And I think the most important thing is with more information, people can feel overwhelmed. So it's critically important for PAs and other healthcare team members to help patients understand what does all this avalanche of data mean so that people don't get worried or overwhelmed. So it's really about empowering patients to understand their own health and partnering with the healthcare team so that they can make better decisions and feel more comfortable and understand every decision that I make, this is how it impacts my health. I think it's just a great opportunity for patients to be more in control.
We've heard a lot about workforce shortages in the healthcare industry. Can PAs help alleviate this problem?
Absolutely. PAs have been around for almost 60 years. We diagnose, we treat, we prescribe, we educate patients, we see them in the clinics, we take their phone calls. I think the one thing that holds PAs back right now is old laws. So some of the laws were written in the 1980s. We need to update them so that PAs are empowered, just like the rest of the healthcare team, to do what they're trained to do. So absolutely, PAs are in demand. We expect 20% growth over the next decade. It's a great career.
And that seems to me that would be an added plus, especially with the shortage of doctors that we have in the United States, correct?
Absolutely. PAs do work in other countries like Canada and the United States and Scotland, But the PAs here in the United States, there's over 200,000 of us and growing. It's a great career. I know you can't tell it because I look so young, but I've been doing this for 26 years, and it's been a wonderful adventure.
I would have never guessed you'd even do this for 26 years. I was just about to ask you, how was graduation last week? What kind of role do PAs play in addressing some of these disparities? But me personally, I go to my local VA hospital, And I have more contact, more of a open relationship with my PA than with, let's say, a physician that works there, or the physician I see in a specialty clinic.
Yeah.
What's the big difference in the big gap that PAs are filling for us?
Yeah, with healthcare disparities, it's really about listening to patients and making sure that we address what they need. If they can't find healthy food, we need to help them understand where they can go. If they need social support and financial support, we have to connect them to those resources. If they're having problems getting their medications, we have to connect them with those programs that will help them get their medications they need. It's really about listening. I think that's one of the superpowers that we have as a PA. My dad said the same thing about he loves his PA. When he goes to his cardiologist, he just loves his PA. He thinks she's the best thing on earth. So, PAs are just positioned. We love our patients. We're connected to them. We engage and we give them the resources and support they need. But really, it's about listening and connecting people to what they need to reduce those disparities.
Yeah, because automatically when we walk into a doctor's office, we can complain right up to the 5 minutes we get in the door. And once we go in there and sit on that table, we shut up.
Right.
Because we feel
Right. So you need to feel comfortable. You got to have somebody that you're willing to just tell everything to.
Yeah, and you get that from a PA sometimes. You get that kind of connection.
Absolutely.
Yeah, I think that's a big importance of it. I get it at the VA all the
I
time.
get it
That's a
for mine.
big difference. Yeah, I think that's.
Well, thank you for that endorsement. Could we record that and play
You
it?
can now, and it'll only cost you
All right.
popsicles too. That's all I'm
That's
going to
it.
charge you. What can
Oh,
you
good.
for more information?
Go
What
to
do we-
PAsGoBeyond.com. Go to PAsGoBeyond.com and you can learn all about us.
All right. Taking part in the AAPA 2024 convention down in Houston for the conference for the American Academy of Physician Associates. Thanks for joining us this morning. Some great information.
Absolutely. It was my pleasure.
Anytime. Once again, if you need more information, go to PAsGoBeyond.com. That's PASGO Beyond.com. Learn about how you can improve your health care with some great folks who really care about you. Man, have a great time. Stay cool down there in Houston. I know it gets hot.
We're trying. It's hot.
All right. Thank you, sir. We'll take a quick break. We're back with more chat right here on Newsday Amarillo and News Channel 10-2.